I'm going to show images and talk about craniopharyngioma. Craniopharyngiomas are histologically benign tumors arising from the epithelium of Redke's pouch. They're pretty rare with a prevalence of 1 in 50,000 and an incidence of about 1 in a million per year. And they occur in the sellar and suprasellar region. There are two distinct types of craniopharyngioma with different gene mutation, different histology, different imaging findings, and occurring in different age groups. And we're going to focus mainly on the adamantinous craniopharyngioma, which is the most common one in all age groups. And I always thought that adamantinous was kind of a peculiar word. It's derived from adamant, which means something that does not bend, something that is very hard. And for your reference, the English word diamond is also derived from adamant. Adamantinous craniopharyngiomas are the type of craniopharyngiomas seen in childhood with a peak between 5 and 15 years, and there's also a second peak in adulthood in elderly patients. And adamantinous craniopharyngiomas are also the most common type of craniopharyngioma in adults. They are partly cystic and partly solid, and there's a mutation in a gene called CTNNB1, which is involved in Wnt signaling and comes to expression in bones and cartilage. Patients present with headache, visual deficits, and hormone disturbances, for example, in children, short stature because of the growth hormone deficit. And these are images of a 12-year-old boy presenting with headache and blurred vision. And on the sagittal T1 weighted image, you can see a sellar and suprasellar mass with cystic and solid compartments, and on the coronal post-contrast images you can see the enhancement of the wall of the cysts and the impression in the third ventricle. Adamantinous craniopharyngiomas show calcification in up to 90%. These are images from the 90s, and on the CT you can see the calcifications in this 30-year-old male with an adamantinous craniopharyngioma, and on the sagittal MR images you can again see the partly cystic, partly solid tumor with again impression on the floor of the third ventricle. Neurosurgeons divide the craniopharyngiomas based on their location, and you can see the growth patterns in the lower row, and the purple dot is the site of origin of the craniopharyngioma. Although craniopharyngiomas are histologically benign, they often engulf the hypothalamic region or the optic chiasm, making it very difficult to get gross total resection. And there is a high recurrence rate, and the behavior of a craniopharyngioma is more that of a malignant tumor. The red dot in these images is the anterior communicating artery, furthermore complicating surgery in this region. This is another image from a neurosurgical journal where you can see the sites of origin of the craniopharyngioma, and they're all located along the pituitary stalk. And the reason that the craniopharyngiomas arise in these locations has to do with embryology. We already talked a little bit about the embryology of the posterior pituitary and anterior pituitary in the previous videos on neurohypophysis and Redke's cleft cyst, so I will repeat it briefly. In the 4th week, there's opening of the mouth, the stomodeum, and then the lining of what is going to become the oral cavity comes close to the neuroectoderm. These layers interact. There's outpouching of the roof of the oral cavity, Redke's pouch, which eventually gives rise to the anterior pituitary. And there's downward bending of the floor of the hypothalamus, which gives rise to the posterior pituitary. You can see with black dots in these drawings by the group from the late Valavanes that the craniopharyngeal canal closes, and the cells from the craniopharyngeal canal end up in different locations, and these cells are supposed to differentiate into anterior pituitary, but something goes wrong. They don't get all the cues, they need to, and they differentiate into something resembling tooth primordia. And if you look again at where the epithelium is coming from, it makes sense because this is going to be the palate, and the dental lamina, which is going to give rise to the teeth, is very close to that. And if you look at the histology of an adamantinous craniopharyngioma, it resembles that of odontogenic cysts and ameloblastomas of the jaw very much. And the title of this article, where these images are coming from, gives away the key point. So it looks like there's normal odontogenesis, so normal formation of the teeth happening in an uncommon location in the sellar and suprasellar region in adamantinous craniopharyngioma. And if you look at the imaging features of an ameloblastoma of the jaw that was previously known as an adamantinoma, you can also see that it's partly cystic and has some faintly enhancing solid components. So the adamantinous material is teeth-like, dentin-like calcification because the cells develop into teeth-like structures in craniopharyngiomas, which makes perfect sense if you know the embryology. If you have a mass in the sellar and suprasellar region, we already discussed pituitary adenomas and Redke's cleft cysts who do not enhance, and we've added in this video the craniopharyngioma with enhancement. And to differentiate the craniopharyngioma and the pituitary adenoma, one of the features you can look at is superior lobulation, and that's something I've mentioned already, and that means that there's another lobule giving impression in the floor of the third ventricle. So these are again images of partly cystic, partly solid craniopharyngiomas in adult patients with this superior lobulation in the floor of the third ventricle. So the adamantinous craniopharyngioma can occur between the anterior and posterior lobe of the pituitary and in the suprasellar region. The papillary craniopharyngiomas occur in elderly patients, and they only arise from the suprasellar region. There's a different gene mutation, it's a BRF mutation, and these are solid tumors without calcifications. And in the case of a papillary craniopharyngioma, the cells do not differentiate toward teeth, but they differentiate towards oral mucosa. So the histology of a papillary craniopharyngioma is that of oral mucosa. And you can see a suprasellar enhancing solid mass in this patient. In the top differential diagnosis, you might think of a germ cell tumor that also occur in the midline suprasellar in adults and mainly in children, and we're going to discuss germ cell tumors in the next Brain Bit by Bit. Thanks for watching.